I'm Kosali Simon. I'm in the School of Public and Environmental Affairs, and I'm going to try and talk in my 5 minutes about the area of health economics and policy, and how I think that there are so many interdisciplinary connections to many other areas on campus, and I want to think about where those might fit in. And already just in conversations I've heard, as Kay said, of many areas I didn't know about, and I really look forward to the interactions in that. So in SPEA, I am one of two health economists. We study healthcare policy mainly, as different from health behavior policy, although economics relates to both, and we like to think about ways in which human behavior and incentives can be put into a formal structural analysis to think of how we might predict human behavior to operate. So I'm going to start just talking about health policy through an example which is playing out right as we speak, which is government action in trying to increase the number of people with health insurance. So health insurance and healthcare access is my main area of research, and it's really exciting to think about how economics plays in health policy in this area. So a health insurance policy is only one way in which we think people's health will improve, and it improves through its effect on whether individuals receive timely and appropriate health care, and then that's what actually feeds into health. So where does economics come in? Well, lots of aspects of this relationship which rely on understanding the connection to human behavior. In particular, the way economics views this is that humans respond to incentives, and price, the cost of an activity, is a particularly important driver, and there are concepts of how responsive consumers are to price. So healthcare elasticity of demand is the term in economics used for this, but it's really just understanding under what circumstances will people respond to being given access to lower price health insurance, and how can we predict what that will then happen to healthcare use, and how does that affect health. So all of these aspects of understanding health come in, and this is an area that, I think there's reason to expect there's a lot of excitement about what the potential is for advancing in this area. And just looking back in time, I found this a startling statistic, that from 2003 to 2011, the health sector added 2.67 million jobs in the U.S. economy. In contrast, all other sectors only added a combined 850,000 jobs. So this is kind of really interesting to talk about. And then both population health and healthcare is subject to so much government activity and regulation, political debates that rely on bringing all the fields together to make fully informed discussions. So just some examples of topics that I investigate within this area, and that health economists and health policy experts. So, for example, whenever there are regulation changes, people would like to know, were there the intended effects? And moreover, are there possible unintended effects that we need to watch out for and be able to quantify? So it's both knowing what the questions are, but also the research methods. So in social science, and this is the way my work relates to technology, I think, is that I'm not a producer of technology, but a consumer of the data sources. So I really love to hear about new ways of collecting data, because it's only to the extent that we have better data that we can answer questions in a better way. So the need for answering these questions in a timely manner is really great. We rely on traditional household surveys funded by the government in many areas where that's not going to be adequate for answering things quickly. So I really rely on learning about how does HIT give us access to better data, for example, to answer these kinds of questions. So I'm looking forward to interacting more and finding ways that there are collaborations, and I really welcome questions.